In corneal allograft rejection, the donor epithelium may be attacked by sensitized...
It's got to be either T or B cells?
Interesting. Yes. No, fair
I don't
point.
know.
Yes.
I don't know. I really don't know.
T cells. Because they're the ones that kill stuff.
They're the killers.
Distribute
yes.
the antibodies.
Okay. K epideposits are most commonly an iron ring.
Yes.
Oh.
Yes.
This is in keratoconus.
Yes.
A Fleischer ring.
Yes, Fleischer ring, correct.
Not to be confused with the copper ring, which is a Kaiser Fleischer ring.
And not to be confused with the Ferry line in front of a trabeculectomy.
Yes.
Not to be confused
Stocker's
with
line.
Stocker's line for tears.
Or a Hudson-Stahl in an old patient.
Correct.
Oh, so many iron lines. Wait a
What?
minute.
No.
Whoa.
Common...
No. I disagree.
K epi deposits. And I don't think it's in the No, it is in the epithelium.
But Hudson-Stahl is not a ring.
No.
It says a line. It's a line.
Yes.
We have to just move on. Name the iron ring.
There you go. Now it's we already said it.
But how could a ring be at the bottom of something? Oh, okay. They're looking at the profile
like
this way for this. We got it. Fleischer ring. Yep. We're good. Geyser flow up like mountain cone. Okay. Whorl keratopathy deposits.
Oh, mnemonic. I didn't know there was one.
Is this the TAY one?
I just know you get it.
Amiodarone, chloroquine, hydroxychloroquine,
and sometimes
Fabry's disease.
And and then the new one, the blockers, for endothelial regeneration, also glaucoma drop.
Rokinase? Rokinase does this?
Yes.
Let's see what their answer is.
Mr. Fabry whirls his chai tea.
Okay, Mr. Fabry.
Chloroquine, amiodarone, indomethacin. I didn't know that. And tamoxifen. Yes.
There. That's a good amount.
Tamoxifen also had retinal problems. Is that correct, or am I confusing that?
That sounds correct. That sounds correct.
Then,
Tamoxifen retinopathy. Is that what you're thinking of?
That is me when I'm sad, and look up.
I want to see it.
Side effects, tamoxifen. Retinopathy, keratopathy, optic neuritis, glaucoma, and ophthalmic vein thrombosis. A lot.
So moral of the story is don't take tamoxifen unless you have a really good reason to do it.
Careful with tamoxifen.
Okay. Most common cause of drug-induced corneal whorl keratopathy is, it's got to be amiodarone.
Yeah, that's what I would have said. Yes.
Nailed it. There it is.
Amiodarone.
Chai tea.
And it's usually not visually significant, and some patients are concerned about it, by the way. Usually I tell them there's two answers from cardiology, as a joke, but there's two answers from cardiology. If you ask them if you can stop amiodarone, one is absolutely not, you'll die, and the other one is like, sure. So it doesn't hurt asking, but it's going to be a very clear answer.
White stuck-on nodules. Oh. They already gave half the answer with nodules, didn't they?
Yes, they did.
Because we got to be talking about Salzmann nodules,
that's
right?
What I think.
Got to be.
Salzmann's. Because of hyaline and basement membrane. That's good to know. And yes, it's on top usually of Bowman's. Hence, basement membrane, right? That's the basement membrane of the epithelium. Bowman's membrane.
We say subepithelial. Could you not say subepithelial or on top of Bowman's? It's
same thing.
Between the two.
Yes.
Okay.
I mean, yeah. The epithelium doesn't grow through it or under it, so it's subepithelial.
Got it. Name a disease where cornea gets keratinized, sickly, and sticks to palpebral conj.
Speaking of which...
Mucous membrane?
Oh, no.
Vitamin A deficiency?
Oh, sorry. Yes. Sorry. Correct. Absolutely. OCP, oculocicatricial pemphigoid, is one. The other one, but that doesn't get stuck, would be vitamin A deficiency, but then there you don't get bruised. So I would more say cicatricial pemphigoid. Final answer.
Let's see.
Pemphigoid.
Oh, and Stephen Johnson.
Correct. Yes, right. Stephen Johnson. And they are very similar. So different causes. Stephen Johnson is a reaction to medication. Ocular cicatricial pemphigoid, there we go, is an autoimmune disease.
Now, how many typos do you see in that answer? I see a few. It just makes me laugh.
Trickle.
Pemphigoid.
Again. True or false? Bowman's layer, however, does not regenerate. True. A defective Bowman layer fills with fibroblasts and connective tissue, creating a permanent scar.
Sometimes.
Now, the permanent scar I disagree with, because we discussed it before, refractive surgery, PRK, you don't always you shouldn't get a scar.
Yeah.
Or the scar is so minute that you can't see it. So I would say false. Even though the first part is correct. True, false. See, I mean, it's true. The first statement is correct, but just the second, they shouldn't have added that.
I think some defects could be a scar, but some wouldn't.
Yes.
Yeah, all right, moving on. Corneal stromal thinning term,
ectasia.
Oh, don't miss that one. Immune hypersensitivity with migration of PMNs.
And lymphocytes. So make an immune edema. Ring is called
Wait. No, I know this. Wesley immune ring.
See, I would have said Weiss, but Wesley sounds better.
I think Wesley sounds better.
I just know it starts with a W.
It's got to be a Wesley. If it's not.
Oh,
yes, a Wesley immune ring.
See, I would have called it Weiss immune ring. Would have been wrong.
I love these questions. Let's still get a few more. Oh, we're at a checkpoint.
15%.
But I think we can do a few more.
Yes. Stromal deposits of cholesterol. You know this. Senile arcus is common after 50. If seen prior to 30, worry about
hyperlipidemia.
Yes, hyperlipidemia. And that is definitely worthwhile checking. It's a blood test. I mean, that's hypercholesterolemia.
Do you worry about patients with arcus in just one eye? And you worry about the eye that doesn't have arcus?
Yes. What was that?
Because they might have carotid blockage?
Stenosis, yes.
Ooh. Hyperlipidemia. There it is.
Hyperlipidemia. Fair enough. Thank you. Dystrophy is a common hereditary disease with abnormal deposition of cholesterol, which we just spoke, or lipids, usually in the anterior stroma of the central and peripheral cornea.
Schneider.
That's right. Schneider's.
Well,
not Schinder. Schneider. Snickers lipids.
Snickers lipids. Wait, what? Okay, Snickers lipids. That's good. Corneal degeneration.
Oh yes, that's an important question.
Is it a question? Where's the question?
You should be able to define it. There's no answer, but yes, dystrophy. It's in two eyes.
Okay.
They pass down. So
and
it
has an H.
Inherited.
Hereditary.
Yes. Oh, that's much better. I like this. Hereditary. Yes, dystrophy, hereditary. That's in both eyes, right? Degeneration, unilateral, because somebody, some degenerate, had a trauma.
Oh, jeez. Good question. Not really a question, but a good concept. Mnemonic for stromal deposits stromal cornea. I know it. Marilyn Monroe always gets her men in L.A. City. County. City. Doesn't matter. Reveal.
Gets high. Come on. Gets her men.
It didn't even say what it stains with.
No
they
stain.
skipped out on all the staining.